My name is Kevin Donnelly Boylen. I'm an attending psychiatrist with the Department of Mental Health at Lemuel Shattuck Hospital. By training, I'm a consult liaison psychiatrist. Prior to this, I was working at an acute care medical hospital for the last several years. I was looking for something where I got to know patients a bit better, work with them longer, and provide treatment that was going to set them up for success for years to come. One of the things that was particularly attractive is that we approach care from a multidisciplinary manner. We come together all the time, every morning, to figure out what the best next step with a patient is going to be. This includes involvement of the patient themselves. Often, and definitely every month, we have a meeting together with the patient and people from the community, if they're involved in their care, to identify what their goals are, how we can help meet them, and what some of our thoughts may be. A typical day for me starts at 8 or 8:30 in the morning, where I come in and get prepared for table rounds at 9 a.m. At that time, I go and meet with all members of the team, a medicine nurse practitioner, the nurse manager, the charge nurse, social work, rehab and occupational therapy, everyone involved in the patient's care to review what's been going on, how they're doing now, and discuss any changes or thoughts we may have for the day. We have rounds each weekday. After this, we often get to attend a community meeting where we sit with the patients all in one group and get to hear about how they're doing, what their plans for the day are, and connect with them in a different way than just sitting with them in a room and talking about symptoms. Many days we have what we call treatment team meetings. Again, we all sit down together with the patient to discuss their goals and how we can meet them. Later, I usually sit with patients, maybe for up to a couple hours until the middle of the day, get to know them better, maybe step aside and review their records, but be able to understand them deeply, both their history, but also who they are as a person. Sometimes in the day, there are some meetings where we all coordinate as a department, whether it's from my own supervisor, the facility medical director, the chief operations officer, or Department of Mental Health more broadly. In the afternoon, after I've gotten to meet with a number of patients, I usually work on some notes. I have to tell you, some of the things that are great here are that we don't have to write that many notes to make sure the patients are getting the best care. That's been a real benefit to me, something that has been different from other places I've worked. I also don't have to worry about ensuring that insurance is going to pay for everything. I'm really focused on each patient. As the day goes on, I may finish paperwork, meet with coworkers to talk about cases, and at the end, leave maybe 4:30 or 5 p.m. I haven't had that opportunity before to have such good work-life balance, to have good hours. I don't have to worry about having call that evening where people call me at home. I have a moonlighter that I can trust to continue to provide care when I come in the next morning. Each week, I get to sit down with my supervisor and discuss cases, talk about how things are going. The facility medical director, the chief operations officer, they're always accessible, whether their door's open, which is most of the time, or just a knock away, and they can talk about anything, from patient care to personal stuff, really anything at all. Some of the opportunities that I've had from very early on in my career here has been involvement in different committees that help shape the care we're providing now and the care we're going to provide in the future. This is including things like the Pharmacy and Therapeutics Committee, where I have input on what's provided and available to patients within Department of Mental Health, but also in the Department of Public Health. People really listen what we each have to say, something that I value as every part of this hospital. Additional opportunities have included the Medical Executive Committee, and with new resident education opportunities, where we're going to have residents coming and working with us, and we'll be supervising directly. It's something I'm personally very excited about, always have been. Shattuck Hospital is a comparatively small space from academic centers that I've worked in. I wasn't sure what to think of it. What I've noticed is that I can get anywhere I want to be in a few minutes, whether that's the unit with all my patients or to my supervisors. In addition to the physical building, the grounds here at Shattuck Hospital are amazing. We're adjacent to Franklin Park, where patients can actually go and walk together supervised, or as they get better, unsupervised. That is a wonderful place to be, to look out the window and see greenery, something I also didn't have an opportunity to do at other jobs. Here, I get to work with people over the long term. I don't see this turnover, over and over and over again. I'm here with people who have been here a long time, and we're working with to really get stability and connect to the outpatient setting where people are going to succeed and not just come back to the hospital each time.